Welcome to this webinar investigating the prevalence and socio-demographic predictors of child food insecurity in Western Australia. This research was supported by Healthway. So what is food security? Well, it relates to physical, social and economic access to nutritious food that meets people's dietary needs and their food and cultural preferences to help them achieve a healthy life. We conducted a study in Western Australia among children in rural and remote areas, and we used a USA tool to measure whether they were food insecure. And this was part of a broader survey that we conducted with children and also their caregivers to understand things like food security, things like the determinants of food security in their place of residence, and also their fruit and vegetable consumption. And you can see here, these are some of the example questions that were used to measure child food security. So the kinds of questions were about whether the child worried that food at home would run out before their family got money to buy more, whether food did run out, whether they had a few kind of cheap foods, such as pasta or bread or rice, things like whether they had to eat less because their family didn't have money to buy more, and so on. When we asked children this set of questions and we classified them in terms of their food security status according to the US tool, we found that 1 in 5 children were classified as food insecure. So that was 20% of the people who were involved in our study. And you can see the breakdown there of high food security, so 2/3 were of high food security, 13% were marginal food security, almost 17% low food security, and then 3.2% were very low food security. So you can see here that the majority or a large proportion of children were from food secure households and were food secure themselves, but then there are a good proportion of students or children who were not. And this is absolutely a concern in a high income country like Australia. This slide is showcasing the individual statements that the most children responded to in terms of saying that it was the case for them a lot of the time. So almost 15% of children said that their meals contained cheap foods, and then 1 in 5 or more than 1 in 5 were concerned that food would run out before their family could afford to buy more. So that was that really more severe end, in terms of their foods being cut, but then in terms of more moderately food secure, it was about that anxiety or the concern about that their foods would be cut. So you can see here that there are a range of different factors that were involved. We also looked at certain demographic or socio-demographic factors that might predict whether a child was classified as food insecure. So these are the kinds of things that we included when we were running our analyses. So we used multiple regression analyses. So things like the caregiver's educational level, their employment status, the number of people within the house, the number of children, and the index of relative socioeconomic disadvantage, whether the family received government financial assistance. And I should say here also that to get the data on these kinds of factors, we paired the children with their parents or their caregivers' surveys. So the caregivers answered these kinds of questions. So we used a parent-child dyad to be able to get these socio-demographic factors from the parent survey and use the child food security survey module from the child survey. Other things included were caregiver age, caregiver gender, child age, child gender, and also remoteness. So what we found when we included all of those factors in our analysis for looking at the predictors of food insecurity, those children that lived in a location classified as a medium socioeconomic disadvantage were twice as likely to be food insecure compared to those that were in those more disadvantaged areas, which could come as a bit of a surprise. You would think that children in more disadvantaged areas would potentially be more likely to be food insecure, but that was not the case. And perhaps a more unsurprising factor was that where families received government income support, the children were twice as likely to be food insecure compared to those whose families did not receive assistance. And if you think about these kinds of families potentially having a low income, and we know that in previous research, income is a key driver as to food security status. So that's not such a surprising finding. So, what do we recommend? Well, in terms of government policy, and these are in no particular order, it is really important to incorporate food security and strategies to enhance it into existing or new plans. For example, local government public health plans, ensuring welfare policies act as springboards out of poverty. So, adequately supporting disadvantaged Australians. Because when we looked at that finding about children who are from moderately from households in terms of medium socioeconomic disadvantage, it suggests that potentially these families might not believe that they need support, or they might be slipping through the cracks. They might have had good employment, but then maybe recently lost the employment. And so potentially they might be from areas that are not overly disadvantaged, but they might not be getting the support that they need. And then in terms of further research, we need to investigate and monitor food security from a range of perspectives, so children, their parents, and so forth, and conducting longitudinal research on the impact of food insecurity on children's health outcomes, because we know that it's an acute problem in terms of dietary quality and quantity of food that potentially is impacted. But what are the long-term implications on children's health? We need further evidence to really understand those implications to help advocacy to address the issue.